If your blood sugar has been creeping up, there's a heart problem hiding underneath that almost nobody's talking about. And it's hitting women way harder than men. I'm not exaggerating either. Heart disease kills one woman every single minute in the US. And if you've got type 2 diabetes or prediabetes, your risk of dying from heart disease jumps by 50 to 57% compared to a man with the exact same condition. Today I'm breaking down why women with blood sugar issues face this hidden heart risk, what's actually causing it, and the exact steps you can take to start protecting yourself. And just so you know, I'm not telling this to scare you. I'm telling you because awareness is the thing that actually saves lives here. And once you know what to look for, you can do something about it. Stick around because near the end, I'm going to walk you through how to actually talk to your doctor about this because most women don't even know to ask. If you want a free checklist with the 10 best daily habits to reverse type 2 diabetes naturally, just comment the word checklist below and I'll send it to you for free. So let's start with the why. Why does diabetes hit a woman's heart so much harder than a man's? A big piece of it comes down to hormones, specifically estrogen. Before menopause, estrogen is basically working behind the scenes as your own personal bodyguard. It helps your blood vessels relax and open up properly, it calms down inflammation, and it even improves your cholesterol by raising your good cholesterol and lowering the bad stuff. But here's the catch. Diabetes messes with that protection. Even before menopause hits, having diabetes blunts the natural shield estrogen normally gives you, which is part of why younger women with diabetes get hit so much harder relative to men their same age. And then when menopause actually arrives and estrogen drops, things get tougher. Your body tends to store more fat around your belly, you become more insulin resistant, and your cortisol numbers often get worse too. On top of that, diabetes can actually speed up when menopause happens in the first place. So some women are dealing with this hormone drop earlier than they expected. Now here's something most women have never even heard connected to heart disease. Pregnancy. If you ever had high blood pressure during pregnancy, preeclampsia, or gestational diabetes, these aren't just pregnancy things that go away after delivery. They're actually red flags your body is waving about your future heart health. Doctors used to think this risk faded once the baby was born. We now know that's not true at all. These conditions point to an underlying tendency toward heart and metabolic problems that can stick around for years. And here's the part that honestly makes me frustrated. Fewer than half of the women who had these pregnancy complications actually get proper follow-up heart and blood sugar screening in the first year after giving birth. So if this is you and nobody's checked your blood sugar or blood pressure since you had a baby, that's a conversation worth having with your doctor, even if your baby is now 10 years old. So why does all this slip through the cracks? A big reason is delayed diagnosis. And it's not because women are imagining things, it's because the system is missing it. Public awareness that heart disease is the #1 killer of women actually dropped over the last decade from 65% down to 44%. That drop was worse for younger women and for Black and Hispanic women specifically. And get this, in a study of younger heart attack patients, only half of the women under 55 even considered themselves at risk for heart disease before it happened to them, despite many of them already having clear risk factors. Part of the problem is that women's heart attack symptoms don't always look like the textbook clutching your chest scene from a movie. Women are more likely to show up with fatigue, nausea, shortness of breath, or pain in the back or jaw. And that gets dismissed or misread far too often by doctors and patients alike. There's also blood sugar testing that's flying under the radar. Standard A1C testing can actually underdetect early diabetes in premenopausal women, especially women with PCOS, which means damage to blood vessels can be quietly progressing before anyone catches it on a standard test. That's actually why current guidelines recommend an oral glucose tolerance test, not just an A1C, for women with PCOS who are being screened for diabetes. Okay, so now you understand the why. Here's the part that actually matters most. What you can do about it starting now. First, nutrition. Both the American Heart Association and the American Diabetes Association point to heart-healthy eating patterns built around whole, mostly plant-based foods while cutting back on added sugar and saturated fat. You've got real options here too. This isn't a one right diet situation. Mediterranean style eating, plant-based, vegan, lower carb patterns, and the DASH diet have all been shown to help with both blood sugar and the inflammation that drives heart disease. The best one is the one you'll actually stick to long-term based on your culture, your budget, and your real life. Second is movement. Aim for at least 150 minutes a week of moderate activity. Think brisk walking plus strength training 2 to 3 times a week. This combo improves insulin sensitivity, helps your cholesterol, and lowers blood pressure. Third, and this one doesn't get talked enough about, your mental health matters here too. Depression and chronic stress are more common in women with diabetes, and they're independently linked to worse heart outcomes, partly through unhealthy coping habits and partly through actual physical changes like increased inflammation in your body. If you're dealing with caregiving stress, financial stress, or just feeling overwhelmed, that's not separate from your heart health. It is part of it. Fourth, know your numbers and push for the right tests. Ask for your A1C, your blood pressure, your cholesterol, and ask whether a coronary artery calcium scan might make sense for you. This is a simple scan that can show early buildup in your arteries, and research shows that women with diabetes who have elevated scores actually face a higher relative risk than men with the same score. So this test matters even more for women. And finally, ask about your medications. Certain diabetes medications, specifically SGLT2 inhibitors and GLP-1 receptor antagonists, have been shown to lower the risk of major heart problems, not just blood sugar. This is a conversation worth having directly with your provider. If you want a free checklist with the 10 best daily habits to reverse type 2 diabetes naturally and protect your heart, just comment the word checklist below and I'll send it to you for free. So let's bring this all together. Women with diabetes face a higher relative heart risk than men, and is driven by hormones, pregnancy history, delayed diagnosis, and gaps in how risk gets tested and treated. But here's the empowering part. Nutrition, movement, mental health, knowing your numbers, and asking the right questions about your medications can genuinely change your trajectory. If you found this video helpful, please share it with someone you may know that it could also help. And please give it a thumbs up and subscribe to our channel if you haven't already done so. Thanks for watching.